Okay, so I have a huge task, but I'll try to deliver it in the most simple way I can and try to touch on things. Just like Dr. Wanko has said, this is an overview. So these are the key considerations that I'll be looking at in our time spent together. So trustworthiness in qualitative inquiry, ethical considerations for research involving vulnerable populations, place of supporting framework in qualitative research, practical logistics in the field, recording tools, transcription and backup plans, building rapport, cultural sensitivity, active listening and handling non-verbal cues. Then a bit of time management, handling challenges and adaptations, field contingencies, cross-cultural considerations, digital data collection. So just like what Dr. Wanko said, we are not going in depth, so it's just an overview. So I'll just highlight some key areas I feel are useful. So getting on straight to trustworthiness in qualitative inquiries. So riding on what Professor Buka just said, the question of what is the truth remains a key part of qualitative research because qualitative research is hinged on subjectivity. It is very subjective because people have different views and different ideas and perceptions of life, and knowledge is a construct. So the respondents or participants, individuals are constructing, having at their what they feel, they are saying, and then the society as well, and then the researchers. So there's a lot of subjectivity that goes on around qualitative inquiry. And it is key to note that time, place, and person qualities affect the findings of the qualitative inquiry. It's surprising to know that things like physical appearance, age, gender, background, previous experience, culture, your position, your expertise or your qualification can impact the qualitative research. But now back to what research is about, being able to identify a particular phenomena. But then how much of a man's or a human's reality and experience can another human paint? Because most of the work that goes on in qualitative research is being able to engage with other humans and try to understand what's going on in their minds. It's different from quant, where you just have a quantitative tool where you're counting numbers and numbers remain as numbers. But with most of qualitative research, you're trying to understand, talk to people and understand what they perceive and what the view of what their experiences are, what they think, and then you now bring it out, and reinterpret it again and present it to the world. But the question now remains how much of a human's reality and experience can another human paint? So trustworthiness is a reflection of how much the truth is represented, because there are concerns, around qualitative research. There are usually concerns that someone is observing someone or talking to someone about their experience. How well can the researcher represent what the person said? What if what was said was misunderstood? Or what if the words didn't come out, exactly the same way? There are always discussions going on around there. So trustworthiness is a reflection of how much truth is being represented. Truth in quotes, because for qualitative research, there is no particular truth. Everything is subjective. So trustworthiness is a representation of the effort and the ability of the researcher to actually try to paint to a huge extent the reality of the phenomenon they are studying. And the acceptability of qualitative research findings is determined by the degree of trustworthiness. So for especially for individuals who are involved in operational research, where you're trying to understand the whys and the hows that go on in programs, or your research work is policy driven, or you're trying to provide evidence to guide national policy and strategy making, stakeholders need to know that the researcher is able to actually produce results that are reflective of their experiences or perceptions or views, and there have not been changes here and there or misrepresentations. So the acceptability of qualitative research is really hinged on trustworthiness. There are four key concepts in trustworthiness. So there's credibility. So the four key concepts I have put out here, and then the ones in brackets are like they are twin in quantitative research. So for qualitative research, we have credibility. In quantitative research, the twin of it is internal validity, and this reflects the truth of the data. How much of the truth is the researcher presenting from the phenomena they are studying. Then transferability. So the twin of it in quant is external validity, which reflects the generalizability of the findings. So if a core researcher conducted a research in a particular, maybe in a particular area, in a particular field, and brings out findings, people want to know, the world wants to know, how well can we take out these findings and, put it in another context and generalize? Can we take a decision? Of course, resources are slim. Data collection most times has now become limited. So generalizability becomes, even though it's not one of the key tenets for qualitative research, but it's becoming something that is being highlighted, because you cannot, of course, conduct a study everywhere, but to some extent you really want to know how well can these findings play elsewhere. And then dependability. So the twin of it is reliability in quantitative research, and dependability reflects the soundness of the methodology and the consistency for reproducibility and stability. What this means, when questions are asked about the dependability of a particular qualitative research work, the questions that surround it are: if this methodology which the researcher has put forward is followed by another group of researchers elsewhere, are they able to reproduce the same findings that this researcher um, put out in that same location? For example, if you conducted a study in Nigeria on tuberculosis and stigma, and you put out your methodology, if some Europeans or if some individuals from East Africa come pick up your methodology and follow it to the latter, are they able to provide the same results that the initial researcher provided? So that's what dependability is focused on. And then moving on to conformability, which for quant is objectivity, and this reflects the degree of the neutrality of the researcher. Of course, for qualitative research, knowledge is co-created. The respondent or the participant expresses themselves, and the researcher engages with them and interprets it. But to a huge extent, it is expected that the researcher is neutral and doesn't superimpose their natural biases on the data collected, and is not interpreting the data from their colored lens, but rather from the lens of the participant. So this is what conformability is about. So looking at practical steps to achieving trustworthiness spans through the entire life cycle of the research inquiry, from conceptualization of the research to reporting and dissemination of findings. So it is important to think critically about how to achieve trustworthiness from the concept note, to be able to put in the right measures to ensure that you are demonstrating to the public that these are the things I put in place to help you trust me, to help you trust my findings, to help you use my findings, to show you that I am not impacting the data negatively, to show you that this is the true reality from the respondent's perspective. So looking at credibility, how can we achieve credibility or improve it? By having detailed observation, spending time. Qualitative research is not quantitative research where you can just put out a questionnaire and you just collect data in a rushed manner, and you quickly analyze and all that. So for better credibility, there's need for detailed observation to really engage with the respondents, to be able to get their views, experiences. It doesn't just happen rapidly. And then having a debrief, being able to discuss with the respondent the findings. So if a research is conducted somewhere, taking back the findings to the respondents to ask, did I, as the researcher, really understand and provide the evidence based on your reality? So it's going back to show what was collected and get their honest feedback. And then, of course, triangulation, using different data, different methods to be able to see if you can arrive at the same data, to see if your data is representative of the reality that it was supposed to represent. And then referral material collection, so having a background materials that provide information about the study area and the study scope and the phenomena. So this will help to provide a backup to whatever findings are presented. And then how to achieve transferability. Purposive sampling, being able to carefully select the individuals that will provide that rich contextual description and data that is required to answer the research questions, and having a thick description of every single thing that happened in the research process. Because before you can transfer findings, for example, in a study done in Cross River State, where our culture is different and everything we do is different, to try to superimpose it, and transfer the findings to maybe one of the states in the north, you need to really be able to demonstrate all this, that the people you're speaking to, you spoke to similar kind of people, and you actually describe thickly and richly every single thing that was done in the research process. So this will help support transferability. And then for dependability, method overlap is one of the key strategies that can be used, using different methods to see if you can, concurrently, to see if you can get back the same findings. Having a rich audit trail, for just like having a thick description, detailing everything the researcher did along the way, to be able to demonstrate to the world that this is actually what was done, and this is the context at which it was done, hence my findings can be trusted. And then having expert opinion, of course, this is one key thing that comes with qualitative research, having an expert to sit and look throughout the lifespan of the research inquiry, to be able to give expert advice on key things that should be done, key strategies, to be able to align the methodology with the methods, the theoretical underpinnings and all that. So this is where expert opinion becomes key. And then conformability, of course, to be able to show that a researcher is neutral and not imposing their bias on the research process. There comes the reflexivity, and the reflexivity should be comprehensive. So the researcher should be able to tell the world how they impacted the data from their position, because different people can collect the same qualitative data and have different findings. We all impact data collection differently. Our age, our gender, our physical appearance, who we are, our power structure can also affect the kind of data we collect. So reflexivity actually helps to show the neutrality and demonstrate it to the individuals who are consuming the findings from the research. And then, of course, triangulation also helps to show the neutrality, because if you're using different data methods and getting the same similar kind of data, it shows that the researchers' biases are silent. So I'll now move on to ethical considerations in research involving vulnerable populations. So research involving vulnerable populations is highly valuable because it helps to strengthen their voices and helps the voices of the unheard to be heard. And then, of course, it supports the key one of the key ethical considerations of beneficence and justice, allowing them also to benefit from whatever positive improvements are coming from the findings of the research. Maintaining the key tenets of ethics is at the core of ethical considerations involving vulnerable populations. So these principles must be employed across the lifespan of the study, and it involves a fine balance between protection and exclusion. For example, if you're speaking to children, how much you want to protect them, you don't want them to be exploited. At the same time, you want the voices of children to be heard. So there must be a fine balance between protection and exclusion, and allowing the voices of the vulnerable population to be heard. And just a keynote, so the word vulnerable in qualitative research has different meanings. So it can be situational vulnerability, or it can be a group, it can be vulnerability that is group assigned. For example, a patient in a hospital that's being managed by a consultant is vulnerable when it comes to qualitative research. If the consultant wants to conduct a research and wants to recruit the participant is no longer autonomous because they are under the care of the consultant, and there are fears of probably rejection from refusal to participate and all that. So that is situational vulnerability, and there's vulnerability that comes with the group assignment, for example, based on particular tribe or physical characteristic and all that. So there are strategies that are in use to limit exploitation of vulnerable population. The usual ones we know: independent review by ethics board, use of informed consent, assent for children who are not up to the age of providing informed consent, and then proxy consent, community consent. Here, the community consultations are done before the research process is conducted, and the community decides whether the research is safe or not. And then provision of support. So if you're, for example, speaking to populations about maybe subjects that will evoke past memories of pain and all that, there should be provision of mental health support to ensure that if in the midst of the research the participant becomes distressed, you can refer them to a mental health service. So that kind of support for risk mitigation should be available, and there should be use of acceptable approaches and language when conducting qualitative research involving vulnerable population, to allow them to participate fully and not allow them to feel or face any risks or harm. So the approaches that should be used should be what is acceptable by them, and the language that is used. For example, I was involved in a qualitative research about involving migrants and the use of skin bleaching creams in the UK. And for the participants, well, of course, the participants were women who had been using skin bleaching creams, and for them, the word called skin bleaching was offensive and irritating to them. They preferred to call it toning. So in the midst of the work, the term skin bleaching had to be taken out, and it was replaced with the word toning to be able to allow them to feel comfortable to participate. So those are the kind of things that should be done for risk mitigation. So moving on to the place of supporting framework in qualitative research. Of course, just like in quantitative research, we are supposed to have theoretical frameworks, conceptual frameworks. So conceptual frameworks are just representation of ideas and how they link with each other, and how knowledge is created. So conceptual frameworks can give an expose, give an idea of cause and effect, how things link together to cause other things. So having a supportive framework is good in qualitative research. It can guide the mind to be able to, for example, to show you how things cascade into other things. But then supporting frameworks may be restrictive. For example, if you're working in a new research area where data has not been collected to a huge extent, if you use a restrictive framework, it becomes restrictive, because the goal of qualitative research is to be able to allow people to express themselves, express their thoughts, express their perceptions, express their experiences. But when you now have a framework somewhere that says this should happen after this. Okay, let me use this practical example. If you're doing a study on teenage pregnancy, so if you're working from a theoretical framework that says most girls that have teenage pregnancy drop out of school, if you now have that at the back of your mind and you now go somewhere to conduct a research that is centered around teenage girls with teenage pregnancy and school attendance or school dropouts, if you have that thing in your mind that says all girls that have teenage pregnancies drop out of school, it will impact how you conduct your research, because it has already closed your mind to the possibilities that after a girl is pregnant, she can go back to school. And it now narrows your mind and doesn't allow you to explore the possibilities that could happen. So that's what happens when you have a supporting framework. So the decision to use a supporting framework depends on the type of research you are conducting, depends on your methodology, the depth of evidence that is available. So if you're running with grounded theory and all that, exploring new areas, it's problematic. If you're working on an area that there has been so much data collected, then supporting framework is good because it will guide your mind to areas that you should focus on and not allow you reinvent the wheel again. And then your analytical approach also. So if you're doing open coding or you're doing axial coding, then if you now fix yourself with a conceptual framework and you're stuck there, your open coding doesn't work anymore because you have now streamlined what should be done. And then degree of flexibility is actually very important. If you decide to use a supporting framework as a researcher, you should be able to know when and how. How far should I use this framework? How far should it guide me, and when should I let it go? Because if you are gathering new data, which actually happens in qualitative research, people go out to look for apples and end up finding oranges, and then they realize that the oranges eventually turn to bananas, and bananas and oranges are even more useful than what they went to look out for in the first place. So if your mind is flexible, you can start off with a supporting framework, be able to be reflexive, to know when it has become restrictive for you to let it go. So looking at practical logistics in the field, recording tools, transcription and backup plans. From my experience, I would say the choice of the tool or the method depends on the researcher's skills. When you're going out to collect data, use the tool that you're comfortable with, what you can fly with without stress. Do not use advanced tools when you cannot cope with advanced tools or you have not practiced adequately with advanced tools. So researcher skills is key. And then what is the time frame for the study? For example, if you're doing transcription, if you follow him, so if the time frame for your study, example, you're doing a nationwide study and you have a week or two to be able to provide the findings, then having to use human transcription becomes more problematic because it's time consuming. You will now have to lean on using AI powered transcription and then be able to do the reviews. And then the scope of your study, of course, if you're doing a nationwide study, countrywide study or multi-center study, and you need to provide the findings to key stakeholders to make decisions, you cannot be going for manual methods. You need to use methods that are driven by technology that can produce the result as fast as you need them. But then you need to also balance it also with the degree of quality that is desired, because of course with human methods you have more rigor, but when you use AI and technology powered tools, sometimes the quality becomes problematic. So human reviews become the best bet at that point. So there's need for proper planning for whatever tool you decide to use. There should be proper planning, proper development of SOPs for you to actually use, especially if you're having a study where there are so many research assistants, or there are huge teams spread in different locations. You need to develop your SOPs for how the recording should be, how the transcription should be, and backup plans. Develop your SOPs on time, and then do your field testing to ensure that all your research assistants have the necessary skills and are able to utilize the tools you have provided for them to ensure that everyone is on the same page. So for whatever plan that is put on the field, proper planning is very essential. Field testing is non-negotiable. It is catastrophic to go to the field to go and try out tools. Some people record better with their phones, and then on the interview day, they decide to use a dictaphone and they start having problems because they cannot control the management of the tool. So for whatever is being decided on, there should be proper planning. So moving on to building rapport, looking at cultural sensitivity, active listening and handling non-verbal cues. So qualitative research involves bi-directional judgment. So as the researcher is judging the participants are also judging the researcher. So to achieve success, it is important to research the culture where the research is going to hold and align properly with it. Understand the dressing, understand the greetings, understand as much as you can so that you can align properly, because that is the beginning of failure when an individual goes into a particular culture and is displaying things that are offensive to that culture. So the researcher has multiple activities going on during the data collection process and must prepare to listen to what is said and what is unsaid. So in order to achieve active listening, the researcher must be well prepared. Non-verbal cues are part of the research process and may reflect poor comprehension, confusion, distraction, shame, guilt or fear from the respondent. And the researcher, it is the onus is on the researcher to be able to pick up all these cues, because during the qualitative data collection process, a lot is going on. The researcher has to be able to look at the questions, follow the data collection guide, be able to elucidate the questions, try to observe if the respondent is picking up, providing the right answers according to the research objectives, and be able to see if they themselves are impacting the data collection process. So it is important for the researcher to conduct self-evaluation, understand your bias, understand yourself, keep your internal environment still in order to notice the non-verbal cues and respond appropriately to them. So before data collection is done, the researcher should be able to sit down and know that this particular research area where I'm working, my mind may hear this kind of thing and block it off, or the researcher may be unconsciously cutting off the conversation of the respondent if they have a negative bias towards the research area where they are working. So it's very important for the researchers to be able to have a proper self-evaluation, to understand themselves, keep themselves out and neutral, and then be still enough to notice everything going on during the data collection process and respond appropriately to them, because respondents will show you when they understand, when they are confused, their non-verbal cues will show. When they are distracted, they will show it out through non-verbal cues. When there are issues of shame or guilt or fear, the respondent will display it, and it is the responsibility of the researcher to be able to pick up, respond, because there are appropriate responses to all of this to enable the data collection process to continue. Because if a respondent, for example, is confused or displaying shame or guilt when a particular question is posed to them, and the researcher doesn't respond, to be able to take that off, the data collection process may be stalled because the conversations may dwindle from there and the respondent becomes silent. So daily reflexivity and journaling are key tools in improving active listening. So the researcher during the data collection process should actually be reflexive every day and ask themselves, how did I do today? Could I silence myself? Did I block off or judge the participant in any way? Was I listening? Was I following up with the non-verbal cues? What did I identify today? Did I help the data collection process, or was I a problem in data collection process? And be able to journal, and with this they are able to improve with the data collection process as the days go by. So looking at time management, scheduling and flexibility for iterative collection. So proper time management begins once again from conceptualization and development of research tools. Most of the work in qualitative research is put into the conceptualization process, but unfortunately in the Nigerian context, most of the considerations are not inbuilt from when the concept note is being developed, and then there are now hitches in the field and the risk mitigation strategies begin to emerge because proper thought was not put into the qualitative research. Just because people usually say, oh, is it not just like a media interview, just asking people questions and they will just answer, but they don't think through these issues thoroughly. So proper time management begins from conceptualization. So for better time management, appropriate data collection guide should be developed with timelines put to it. Recruitment should be conducted with the participant information sheets disseminated about 2 weeks before data collection, with weekly notification and reminders at least 2 days before interaction with the participants. The expectation of the participants should be managed by the researcher. The researcher should be able to reach out within these 2 weeks to be able to answer the questions of respondents, because when people get a participant information sheet, they start wondering, what do they want from me, what do they want to hear from me, and they have questions around all that. So the qualitative researcher should be able to answer all these questions to ensure that they are following up appropriately, so that on the data collection day, there are no disruptions during the engagement. So there should be a schedule of at most 2 interviews or focus group discussions per day for whichever methods are chosen. These are the common methods we use in our space. So these are the ones I decided to focus on. So doing more than 2 interviews or more than 2 FGDs per day is counterproductive, because at this point the researcher becomes less effective and less efficient and doesn't follow up and listen thoroughly to the data. Because one key thing during qualitative research data collection is that the researcher is listening to the data. They are not just it's not just like a media interview where you ask people questions and they just answer. But here the researcher has to keep actively listening, to actively listen to what is being said by the respondent, to be able to review it or refresh it or restructure it to ensure that the answers that will fit the research questions are collected. But having too many schedules per day becomes problematic. So there's a need to keep focus on research objectives and establish boundaries during qualitative data collection, because some respondents would digress from the discussion and move into other areas that are not relevant and burn up the time for collection of valuable data. So there should be boundaries established, and this should be shared with the respondent. So there's a note here about assessing saturation. So saturation depends on your theoretical background and your methodology. That is, you have to assess, you have to consider this before deciding when you've hit your saturation point. So for most qualitative researches that go on, saturation is hit when new information is no longer available. When you've collected and sampled so many people and then no new information is coming up, then they can say, oh, we've hit saturation and all that. But then it should be considered based on the methodology and the theoretical background. So handling challenges during data collection. What are the key tips for risk management? The data collection plan should be developed with reasonable timelines. Sorry for that, it's timelines. With timelines. It is unreasonable to want to conduct 10 interviews in a day. It's unreasonable to want to conduct 5 FGDs per day. And these are the issues that come up with operational research in the health sector space. So little resources are given to qualitative data collection because people see them as just ordinary media interviews or journalism, and then unreasonable data collection timelines, unreasonable schedules are drawn. So the data collection plan should be drawn with the eyes of an expert to be able to look at it and say this is achievable to give us the quality of data we need. There should be appropriate communication with the gatekeepers and the participants. So this helps to reduce the challenges. This helps to reduce the issue of respondents not turning up, or respondents turning up and halfway through the data collection process, they walk away and tell you they have another appointment. So communication should be clear with the gatekeepers and the participants to let them know what are the expectations of the researcher, how much of their time do you want, what areas do you want to explore, and all that. It should be well clearly trashed out before the data collection day. All possible risks should be identified and then a risk mitigation plan. Chaos. Qualitative researches, well, everyone plans for the best, but usually some chaos usually turns out in the field because human lives are dynamic. Some respondents will not turn up. You have to have another plan, or they walk away in the middle of the interview, or a respondent can say, oh, I'm distressed, or I'm not in the mood to talk today. You cannot actually not force people to do that. So there should always be a risk mitigation plan to be able to manage all such issues, and this should be developed at the conceptualization stage, looking at what can turn up on the field and how this can be managed, and then adopting a flexible stance. Every qualitative researcher has a flexible mind. You can plan ahead, you can put in all the strategies you want to ensure that things go perfectly, but somehow some chaos happens. But then the thing is not to be fixated. Find a way around it. Break the box. It's not thinking outside the box. It's called not even having a box at all. Finding a way around it, or to be able to still get the quality of data that is required. So it involves a lot of flexibility. If it doesn't work this way, then another way will be found. So looking at digital data collection, the pros and cons of virtual platforms, Zoom and social media for remote research. Well, this has become more common, and for us in a resource constraint setting, it can be very easy for any individual to fall into remote data collection. But what are the advantages? It's useful for researching vulnerable or unreachable population, people that would never come out to speak to you because of their situation or their circumstance. You can reach them via remote research. For example, COVID-19, the lockdowns and all that, it was impossible to actually go around and meet people and talk and ask them about their COVID-19 experiences, but with remote data collection, it was possible. So with remote data collection, there's easier means of reaching a larger number of participants for recruitment and participation. And this is cost effective for the researcher and the participant. Of course, it's cheaper. Instead of traveling around from state to state, interviewing different people or having focus group discussions, having it on a platform, virtual platform like Zoom becomes really very interesting because it cuts out cost, logistics, and unnecessary stress for everyone, and is useful for discussion of sensitive topics. Of course, if people do not want to be seen but want to be part of the discussion, then remote data collection using virtual platform becomes one of the key things to lean on. But what are the problems that come with it? There's less efficient communication. The respondents can be distracted, and non-verbal cues are more difficult to pick because you cannot see if you ask a question and the respondent is afraid and shaking, or the respondent is distressed, you cannot see it because they are on a virtual platform, and this becomes a problem because if that situation is not picked and addressed, then the data collection process begins to go downhill. And then there's a possibility of exclusion of individuals that lack the technological background. Of course, if you're doing research that is data collection is hosted on Zoom, the women in the villages, what do you expect them to do? That means the researcher has found a way to exclude them and their voices are no longer heard, and that now becomes part ethical problems around it. And then it's not suitable for some methods. For example, ethnography, you cannot have a deep into people's cultural settings on Zoom. You have to go there and immerse yourself. The researcher has to go and immerse himself in the data appropriately, so it's not suitable for all the methods. And then connectivity problems, network may fail, it may rain that day, the whole data collection process becomes problematic. And then, of course, breach of confidentiality. If you're interviewing, for example, an individual who doesn't have the technological background but has a relative who helped them to set up the platform and is sitting with them during the discussion, of course, you've breached confidentiality because the conversations that will be going on will be heard by a third party, and that usually is not the plan. So there are issues around breaching confidentiality for people that have gotten a third party to support them in setting up the technology for this. But there are ways to mitigate this and work around it. So I've come to the end of my presentation. Thank you so much for listening.